Bisecting angle technique. In this video, we will cover the basic tips of the bisecting angle technique. The bisecting angle technique uses the rule of isometry. The rule of isometry states that two triangles having equal angles and a common side are equal triangles. In dental radiography, this means that we can take periapical images of the teeth by using this technique and imagining two congruent triangles or equal triangles to take these periapicals. For this technique, you can use stave, snap array, or bite blocks. Typically in our lab, we will use the sticky bite blocks. For this technique, the patient position is important. The patient must be seated in an upright position. The occlusal plane must be parallel to the floor and the mid-sagittal plane must be perpendicular to the floor. The receptor must be placed as close as possible to the teeth. The receptor must be placed against the lingual surface of the teeth, and you must cover the correct teeth for each exposure. For vertical angulation, place the central beam or the tube head perpendicular to the imaginary bisector angle of the tooth, which is formed by the long axis of the tooth and the plane of the receptor. For the horizontal angulation, the central ray must be directed to the contact areas of the teeth, making sure the receptor is completely covered by the PID in order to avoid cone cuts. When exposing maxillary teeth, the tube head or the PID must be directed downward or towards the floor in order to get a positive position. When exposing the mandibular teeth, the tube head or the PID must be directed upward towards the ceiling in order to get a negative position. It is important to keep in mind when taking these radiographs on a patient to never let the patient use their fingers to hold the receptor.